Hello everyone, welcome to Dr. Kim's Dental Radiology channel. Today we are going to look at a patient's case where a tooth was extracted for dental implant and we took a cone beam CT scan of the area for the evaluation of the underlying residual ridge. So the area in question is tooth number 13. As you can see, we have 11, here's 12, 13 is shown here with largely missing its crown, and we have tooth number 14. So yes, the crown of number 13 is missing, and you can tell that this root has endodontic filling material along the canal, and possibly there may be dilaceration of the roots with lateral canals or a canal that's going into the second roots possibly. So let's take a look at that again on another periapical radiograph. There you go. Here we have a root, and looks like we may have possibly another root in this area. It's a little unclear from this radiograph, but these roots are extracted, and let's take a look at that in cone beam CT. So now I'm going to move my crosshairs to the area of interest. Okay. And immediately I want you to see that tooth number 13 is extracted. So here again we have 11, 12 with two roots, and 13 is missing, right? So yes, this tooth is missing and the ridge is healed. But importantly, as I scroll through the entire edentulous site of number 13, do you see this? Excuse me, I'm going to, let's see, move our crosshair to this area, right there. Okay. So what is this linear opacity with a thin radiolucent rim that measures approximately 5.5 millimeter in length, and it's located palatally within the alveolar process? And also let's look at its shape in the sagittal view and also in the axial view. Not only that, evaluate where the location of this is within the alveolar process. Alright. Based on some of the example or videos that I have previously made, and now that you've seen a number of cone beam CT scans, I hope you guys can pretty much agree with me that what you're seeing here is a retained root tip. Yes, so this is a root fragment that has been left behind after the extraction. It has failed to be removed entirely, and it's still positioned under, or in this case I could say above or under the soft tissue. So yes, so that's a problem, right? If you're placing implant in this area, you probably want to take that out. But this position is interesting in that it's located palatally within the alveolar process. Remember when we looked at periapical radiograph, I had suggested that this root may have two roots, and the root outline was a little bit interesting, atypical, right? So based on that and seeing what I'm seeing on cone beam CT, it's most likely that this tooth has two roots, just like the buccal and palatal roots of first premolar. So that this person had probably the buccal root entirely removed, and then the palatal root fractured off, And remember that it had the endodontic filling material that's going all the way to the apex of a single root, whereas there was a part of the filling material extruding or extending into the side of the root, and we had a hard time visualizing where it was going. It's very possible that the filling material was partly filling in the palatal root. Again, it's just my hypothesis, but at the time of the dentist doing a root canal therapy, he or she expected perhaps a single root only, and then the person managed to fill a single canal, but perhaps not the other, which may have led to the failure of the root canal treatment. And now here we are with extracted tooth, but again with a retained root tip. So this needs to be again taken care of before placing a dental implant. But otherwise, this ridge now has healed beautifully besides this root tip. So let's take a moment going to go back to the periapical radiograph and see the original one. So here we have a root with endodontic filling material, and you see this other curvature. It's hard to tell exactly where the PDL outline is, but if I had to guess, I see this part of the PDL space, right, for sure. So that could be the palatal root, right? I don't know for sure, but again, it could go something like this. Anyway, let's go back to cone beam, and there you go. So this area needs to be taken care of before placing dental implant, and I hope you found this video helpful, and I'll see you in the next video. Thank you, and please click the like button if you have enjoyed this content, and be sure to subscribe, and I'll continue to upload my videos 3 times a week. Thank you very much, and I'll see you next time.